Sponsored by Canada Diagnostic Centres, offering MRI, X-ray, and ultrasound services in Calgary and Okotoks.
It's World Mental Health Day, and the World Health Organization this year focusing on living well with schizophrenia. Health specialist Leah Sarich joining us now with how this brain disease works and why it's so helpful to diagnose it early.
Yeah, it really is. So schizophrenia is a brain disease. It runs in families. It's usually diagnosed in adolescence or very early adulthood. I spoke with psychiatrist and professor Dr. Ann Duffy about what the disease usually looks like.
It's characterized by a number of different things. So changes in one's thinking, so the person will have actually false beliefs or delusions, be out of context with reality, interpreting their environment differently. Oftentimes they have perceptual disturbance, so for example, hearing things that other people can't hear, such as voices, talking to each other, talking to them. They'll also not uncommonly have other sensory problems, such as seeing things that other people can't see, so that aren't really in the environment.
Yeah, so those are the things we sort of recognize when it comes to schizophrenia. Also involve changes in drive, so the person might become a little apathetic. They're not really getting out there and doing what they used to do. The disease also has a negative effect on relationships. You can imagine if you're all in your head and you have all this stuff going on in there, it's really noisy in there, it's going to be really hard to connect with other people. So it's a problem in relationships. It's also often found, like there's early signs, early warning signs in young people, if you're aware of them. And particularly if there's a family history, you want to keep your eyes open for some of these things. So those include teens who are falling off their trajectory at school. So they were going along this one path and then they sort of fall off of it. They fall off of it. That's one thing. And it's not an IQ or intelligence problem at all. It's simply that they're not meeting their sort of potential, if you will. Also in coordination, which is really quite interesting. So not necessarily just in sports, but you could see it in sports, but even fine motor skills. So if they're trying to do crafts or paint pictures, things like that, those things might not be meeting the normal standards. Also issues with social relationships in these young people as well. They might be removing themselves slowly from their peer group, their social group. And it could be because they're afraid of their peers. They're feeling sort of over-scrutinized and things are happening that aren't really happening. So you have to really ask them, why aren't you hanging out with the people you used to hang out with, that kind of thing. The other thing that there's a lot of research in now is substance abuse. So doctors do know that these kids, you know, most kids are going to experiment, but these kids, they're doing this more often. So this is more of a problem for them. And it's a double whammy, really, because what they're doing is they're damaging the organ, of course, that we're trying to heal. So it's really, really tough. And so it's really critical, of course, to intervene early with these kids. So if we can find those warning signs and intervene early, this is great, because let's remember, we want to prevent damage to the brain over the long term, and the brain actually isn't finished developing until the age of 25.
Okay, we see the signs. What can doctors do?
Well, first off, pharmacology, right? So obviously we're talking about medicines and drugs. There's lots of antipsychotics out there. All of them have side effects, as all drugs do. The main one with the antipsychotic family is weight gain, so not exactly a desirable thing for sure, especially if you're dealing with young people. So it's a matter of judicial use. That's the words they use. Judicial use of medication to get the lowest dose, to get the desired effect, and you want to be on it for the shortest term to get that same effect that you're looking for. But Dr. Duffy says there are new antipsychotics that have fewer side effects coming down the road, so this is a very hopeful thing. The other thing that's really exciting in the area of psychiatry is things outside of pharmacology. So for example, things like strategic use of lifestyle changes. Dr. Duffy says that's making a huge difference in psychiatry.
Exercise, which of course, when you think about perfusing the brain with blood and our circulation brings oxygen and removes toxins. So of course, the more fit you are, the more fit your brain is. The better your nutrition, the more resilience you're going to have. So these are common sense measures which we have had dramatic effect in other medical illnesses like risk of cardiovascular illness, for example, childhood obesity. I mean, same applies to psychiatry. Psychiatry is no different in that regard than any other medical illness.
It's interesting, eh?
Isn't that
Nutrition,
interesting? Yeah.
you know, flooding the brain with blood.
Exactly.
Yeah,
Now, to be clear, these lifestyle changes are not going to treat an acute psychotic episode, of course. You're going to need your medications for that. But you can imagine that if you were to do the two things together, so not only are you doing the lifestyle changes, so really good diet, lots of exercise, and you're taking your medications properly, this could mean you can actually live well with schizophrenia.
There you go. Very
There you
cool.
go.
All this information is going to be on your
All
blog.
on my
right?
blog, you bet.
Good stuff. All right. BreakfastTelevision.ca. That's where you find Leah's blog. Good to hear from you, Leah. Excellent stuff as always. 8:47.